Hi, I'm Bill Grambley. I'm the CEO of AllazoHealth. I've been with Allazo about 5 years, and prior to that, spent a little over 10 years at CVS Health. Most of that 15-year period, I really focused on how can we help patients get the most of their medications. And clearly there's different factors that you would think about from a CVS perspective than what we currently do. But most of that time has really been focused on things like adherence or helping people start therapy that they've been prescribed. At AllazoHealth, we have an AI-based platform that we use to predict patient behavior, personalize the patient support experience around that patient, and through ongoing learnings and ongoing analysis of that patient behavior, really maximize the impact on that patient journey. And we'll talk a little bit more about that, but at Allazo, we spend most of our time working with pharmaceutical manufacturers in their patient support and or marketing programs. So when you think about the rare disease patient, they face a very unique set of challenges relative to kind of broad diseases that people are faced with. And those include everything from just diagnosis to gaining access to the right experts to obviously navigating the medication landscape. And when you think of the experience there, one of the key challenges is that it's very hard to take learnings at scale and apply them to this rare disease population where, I mean, quite literally, the patient population is measured in the single to double-digit thousands, as opposed to hundreds of thousands or millions of patients in the U.S. alone. And so one of the ways that we approach this question, when you think about each patient as a person, when you have a patient support program or some kind of outreach that the pharmaceutical company is supporting, what you really want to try and do is make that as impactful on the individual as you can, really support that individual. But the way to really do that is to leverage things like AI and aggregate level data, but now apply that to that individual. So as an example, when we approach this question, we have learnings right now across almost 30 million patients. And each of those patients we think about as an aggregation of a lot of different characteristics, a lot of factors that will describe those patients. So now when we think about things like what barriers exist to starting or staying on therapy, how do those individuals interact with the healthcare system, those types of behaviors, we can now use learnings across the board and apply them to support these individual patients. And let me give you an example. So I have a friend who is a patient. Her name's Ella. And she shared with me her own experience when it comes to patient support programs. So she has a rare disease. The pharmaceutical company that create and manufactures her medication that she uses, it's a branded medication. That approach is very personal in the sense that they asked her how her last vacation was. Like they track that kind of part of it. But it actually didn't support helping her get through the kind of annual PA process she had to do to stay on her medicine. And now when you think about her as a person, yes, having a relationship and being able to talk about, what's going on in her life is important. But helping her get through all of this medication-related behavior and barriers that could come up was really what she wanted out of that program. And so in that instance, we could look at, again, millions of patients and understand, well, you know what, every year at this point in time, she's going to have to go through this process. Here are the ways that we can support her through that process. Here's the proactive outreach we need to do to help her get through that process. And here is the ongoing support that we can provide, knowing people like Ella in that type of program. So when we think about the power of AI, it's really taking all of these learnings, all of this data that you can leverage within the healthcare system, and applying it to support these patients going through just incredible experiences that are challenging for them individually and the healthcare system broadly. So another way to kind of break this down, within the rare disease space, often there is a long time to get diagnosed, right? The symptoms may be things that have to go through a period of time before they're really understood. You may need to go to new experts. You may need to find different doctors who can actually diagnose with a rare condition. I mean, again, just by definition, these are not well-known and well-understood diseases. So all of that process has to occur. And then now the pharmaceutical companies are spending a lot of resources to create medications that support those patients through their disease, in some level of treatment. Those types of experiences are often challenged by social factors that occur within the patient population. And we'll just take two extremes. You have a patient, let's say, on Medicaid, maybe they're a single parent, maybe they have a complex set of family dynamics that they're trying to support children, et cetera. And then on the other end, you may have somebody who is relatively high income, wealthy, maybe has great private insurance. The experience of those two people with the same disease is going to be drastically different. And even something as simple as finding a doctor who can treat that disease is going to be wildly different, right? One has resources, they can travel, they could go stay in a hotel near a medical institution that specializes. One is going to be very challenged to support the same thing. So now if you think about that variety of experience, if you approach both of those patients related to these medications in the same way, you're going to get a vastly different level of impact. And so when we think about these patients, we actually bring together a much broader set of characteristics about each of those individuals. I mean, even something like income or household composition or car ownership, right? They're just very different people when it comes to their experience in the healthcare system. So when we start to make predictions and when we use AI to really personalize a program for each patient, we bring in all of those different characteristics that we can get access to in order to personalize that experience for each patient. And again, in those two extremes, they're going to have very different experiences. They're going to have very different levels of support that they'll be able to do. They're just going to have very different outcomes if you don't personalize the experience. And that's really what we want to try and do, is help each patient get the best outcome that can occur within the ecosystem around these rare diseases. So today, most of our business is with pharmaceutical manufacturers. We are focused on helping them personalize and maximize the patient support that they deliver to patients on their medications. Now, we do certainly recognize that is one part of healthcare that this technology can support. And so we do offer this to other organizations, and we have a history of that. But our main focus right now is in that pharmaceutical space. These manufacturers create these patient support programs to really help patients get or stay on the medicine that the doctor has prescribed. And, insurance companies often create, prior authorization processes. They create maybe a step therapy program where you have to try and fail other therapies before you move to one of these therapies. And these programs exist to support patients on that journey. And so we can make that journey, again, more personalized and more impactful to support each of those patients individually. So there's a few ways that they're involved. Obviously, they are the ones that diagnose and then prescribe the medicine, right? And so And so in that process, though, often, again, in the rare disease space particularly, often there are challenges just getting to the point of diagnosing and then prescribing the medicine. And so where we get involved kind of after that prescription is what resources can be brought to bear to support that prescriber's decision. In that process, there may be times where the prescriber gets an outreach from the pharmaceutical company's program, could be a specialty pharmacy, right? There's a variety of organizations that may reach out to the prescriber. And obviously responding to those and supporting those. And a piece of it, if I go back to my Ella story, obviously there are processes that occur that the prescriber is central to within this medication journey. And so how we can support that process and how they engage with that is going to be important to that overall success. Unfortunately, there is a lot of process in the healthcare system that we need to manage. And so engaging in that process and particularly where we're able to really personalize that program around the patient, but that includes the prescriber is obviously a factor that can support the overall positive outcome for the patient. So when we think about these processes, and again, I'll use my Ella example just as a background here. In the instance of understanding the patient, engaging the patient in a way that they will find most impactful to their journey, and then continuing to monitor and support that patient over a long period of time. We'll kind of look at each of those components. When the patient first gets a prescription for one of these medicines, again, there is typically some process of a prior authorization, or they've gone through other medicines and failed. Often when this occurs around the time of diagnosis, there's clearly a lot of emotional, mental, there's a lot of stress on the patient trying to understand now, how do I, live, support treatment, all of those things. In that process, they will, engage in one of these programs. Sometimes the doctor actually enrolls the patient in those programs. Sometimes it comes through a specialty pharmacy. Sometimes the patient can enroll themselves. But upon that kicks off a process. Far too often, we actually see these patient support programs being very scripted instead of personalized. I'll touch on that. But when that enrollment occurs, that kicks off this process. At that point, there's a lot of different things that can be deployed to support the patient. Anywhere from email content, educational content, supporting that PA process, could be financial levels of support through either things like a copay card, or reference to different foundations that may support patients with that disease. So there's a lot of support that goes on in that very early phase. One of the challenges, though, is that support tends to be, again, very scripted, very rule-driven, and not actually reflective of what that individual patient needs, as opposed to what does this program as designed have as a flow for that patient. And so when we get involved, we actually take that and now make decisions, or at least recommendations, about what should be deployed to support the patient. An example would be some patients might be very concerned about injection type process, right? I need to inject myself with this medicine. I need to do it every day or maybe once a week. Maybe they have a fear of needles. There's a lot of angst around that can occur. Whereas another patient might be much more concerned about side effects. Another patient might be concerned about balancing the cost of that with buying food for their family. Another patient might be concerned about getting to the pharmacy on a regular basis to access the medicine, or being home when a shipment arrives for that medicine, and it's got to be a cold pack, and it's got to have a lot of controls around it. So all of those are going to be different for each individual. And which of those types of support do we provide at each point in time? And patients may not even be quite aware of some of their concerns. And so when we apply the AI, we actually start to drive the level of support that we've learned from lots and lots of patients to now get that patient the support they need to continue on that journey. Even further, though, is the ongoing kind of support. How frequently do you touch base with a patient? How much content do you send on email? Do you have opportunities to engage via text message, which is much more common now than it was even 5 years ago as a means of communicating with patients? Do you leverage even social media to engage patients? So there's a lot of different avenues today that didn't exist. And again, by applying the AI, now we're actually driving that patient engagement at a different level in a way that supports the end outcome of their treatment. Far too often, as I had mentioned, these programs are driven by a set of rules, and those rules do tend to ignore the patient specifics. The result of ignoring some of that is that you end up not providing enough support to the most vulnerable patients while providing a good amount of support to patients who have traditionally had an ability to engage in those ways. And so I'll go back to my Medicaid patient versus my higher income private insurance patient. We have seen, and the pandemic showed this even more extreme than I think people thought in the past, that social determinants of health really drive outcomes when it comes to a whole variety of conditions, diseases. And again, in the rare space, I think it's even more extreme because one has the access, the resources, the ability to really navigate a complex set of diagnoses and doctors and this experience, and one may be much more challenged on that for no other reason than just the financial side, but it could be even broader than that. So when we engage, we really try to think about how are we addressing health equity as part of these programs. We did a study with Walgreens that really looked at health equity. It was published several years ago. And when we applied our AI and actually brought in these factors around social determinants of health, we were able to increase the level of support for those most vulnerable patients by 26%. So actually now supporting patients who are more vulnerable with more support. Again, if you're not looking at those types of things, you're going to be missing opportunities to really provide the right support to your patients. And the end result of those things is that we believe that healthcare experiences and these patient journeys should be personalized, because that is the way that we as healthcare consumers think about everything else in our lives, right? Our Netflix screens, our Amazon, like all of those things reflect who we are. And yet healthcare journeys and healthcare experiences are often not that way. So when we engage and when a patient is actually the recipient of these kinds of programs that use AI-based tools to really drive that experience, they start therapy faster, they stay on therapy longer, and they get better long-term outcomes because of the kinds of support that we can bring, instead of a rule-based approach, which actually ignores a lot of what's happening to those patients outside of their one specific medication.